So I had seen 35 different practitioners throughout the course of my recovery before actually coming to the Deering Clinic. The therapist I was seeing at the time told me it was, beyond her scope of practice and refers me to like a neuro-ophthalmologist outside of their clinic. They were able to tell me there that I had severe damage to my visual processing system, and there was a whole slew of things going on with my vision. They told me that they had no idea what was wrong with me. They were guessing with my treatment the entire time, and they were all out of guesses. Not only did I have a concussion, but I also had brainstem shearing because my head was turned when I was in my car wreck when the crash happened. I actually lost awareness of the entire left side of my body, so I couldn't feel it. I couldn't move it without moving the right side of my body, but when you're not aware, you're not aware. When I got into the Deering Clinic, I could walk for a very, very short period of time, but when I was walking, I was dragging my left leg. What I was kind of experiencing was extreme fatigue. I couldn't walk to the shower to bathe myself without running into a wall or falling down and hurting myself. I couldn't hold a conversation. I couldn't speak. I couldn't formulate thoughts. I had a really bad slur. I had right off the bat had super sharp shooting pains go down the entire left side of my arm, and then everything just went numb. I had a lot of typical concussion symptoms that you would think of with headaches, being sensitive to light, nausea. I was watching myself go through life, but I wasn't actually here. When your life is on the line, it's obviously really serious and it matters. And after seeing as many practitioners as I saw and everything that I had experienced beforehand, it was a lot coming to a new practitioner. I didn't know what to expect, even though I was told that, Dr. Deering was gonna be able to help me get better. So right off the bat, I noticed just from, like I said, Dr. Deering's demeanor and the way that he was explaining everything and the way that he interacted with me just on a person-to-person level, that I wasn't just another patient, that he actually cares, and that the resources were here that I needed to actually be able to recover and get my life back. I'm pretty sure, if I remember correctly, it was 3 or 4 days of testing, making sure that every single system was tested for, everything was accounted for, so that they could treat the whole picture of it, everything, and make sure that I was getting the treatment that I needed and nothing was missed or brushed under the rug. Going through the whole multiple disciplinary process of literally doing almost everything that the clinic offers, I have been able to get back to this point. And one thing that I have noticed is how important every single piece of the treatment is, and that was, I think, a really big missing part from a lot of the other practitioners beforehand. Was somebody might have been able to offer me something that might help a little bit, but it was really, really important to have all of these different modalities at the same time working together, because even though we're simple beings, at the end of the day we also are incredibly complex, and there was so many different things that my brain did need in order to actually get better, and so being able to engage in all of the different modalities at the same time was really, really important and was really helpful in getting me back to this point. When you come into the Deering Clinic, it's incredibly supportive. It's very nurturing. It's very person to person. Literally everybody here just wants to build a relationship with their patient, with every patient that comes in to the clinic. It's a very friendly environment, and just it's a really great place to be.